This serene and simple life is of the tribal people who live in the interiors of the state of Maharashtra. The district is Dhule and the tribals are Pauras. It's a hilly forest region where many modern amenities are yet to reach. For their livelihood, they depend on the forest but are also agriculturists. A conscientious doctor called Amar Solpure, who was teaching in the medical college in Mumbai, was transferred to Dhule, and with him he brought new ideas of improving the lives of these simple children of nature.
And being away from the family which I left at Mumbai, I was all alone. So practically on Saturdays and Sundays, with my driver, I used to go into the interiors of Dhule district to study the population. I asked people who were with me that how these people must be living here. It is such a difficult area and what must be happening. And as I was going, I came across certain villages also which are known as Padas there. And these Padas are nothing but hamlets comprising of 25 to 30 small huts and located on peaks of the ravines. And there some of them were half naked. I had an opportunity to interact with them, and casually while discussing with some of them, I asked them about how do they deliver there and what are their problems of delivery. For my surprise, I was told that delivery in these villages are carried out by what are called as village ayas, who happens to be the senior most lady and oldest lady in the village. It is by tradition. It took me another 2 years to go in details of the problems of the tribals in those areas. Then at the end of 2 years, I came out with a book called as Tribals of Dhule, Their Problems and Solutions.
In his book, Dr. Solpure vividly describes the living conditions of the tribals and the difficulties faced by them due to poverty, illiteracy and alcoholism. They are a superstitious community and prefer to go to the shaman or a quack than visiting the doctor in the primary health center. Child rearing is considered the responsibility of the mother. Pregnant women do not receive any special care or sufficient nutrition. They continue to work till the day of the delivery. Services of the primary health center are underutilized. On the one hand, because the people are superstitious, and on the other, trained midwives from the PHC find it hard to visit the interior villages which are not easily accessible. The mother and child mortality is high. Though basically a happy, healthy and self-sufficient community, some of their health practices are based on their ignorance and superstition, which create serious health problems, especially during the childbirth. These communities are unique in having male guides for conducting the delivery. Only in emergencies, when the Dai finds herself totally incompetent, she or he would let the woman be carried to the primary health center. But many a times, it's already too late, and the mother and the baby pay the price.
I thought of the ways to control the maternal mortality, which was the major problem according to me. Now, for India, it is said that 4 per 1,000 live births is an average maternal mortality rate. Compare this with the USA, where it is even less than 1 per lakh deliveries. This is very much for India. And in tribal areas, it's in my own studies, it was found to be nearly 18 per 1,000 deliveries, 18 to 19 per 1,000 deliveries. This was too high a maternal mortality rate for any civilized country. Therefore, I took it upon myself to do something about this, and I discussed with various people involved in such issues, and then I came out with the project, which I called as Tribal Woman Leader of Health project. The whole idea was to create a leader from the tribal women who could not only take care of the maternal mortality problem, but also take care of other health-related problem, and later on, if necessary, transform them to the leaders of the society as a whole. And the question was of funding for this project.
Dr. Solpure, through a friend, approached Dr. Jagannath Vani, who is always ready to support innovative and relevant social service projects.
So he brought the project to K.S. Vani Memorial Trust, and then the trust approached Maharashtra Seva Samiti, and we liked the project, so we started working on it. And while it was Foundation of Alberta as well as CIDA, that is Canadian International Development Agency, both liked the project, and they agreed to co-fund the project with Maharashtra Seva Samiti. That's how we started the project. So initially, we were depending on Dr. Solpure's team, which was coming from the local government medical college and the hospital attached to the college. Unfortunately, Dr. Solpure was transferred, and the whole project came to an end as far as civil hospital was concerned. So we approached Vanvasi Kalyan Ashram.
Vanvasi Kalyan Ashram is working in the tribal sector for about 20 years now. And hence, when Dr. J.K. Vani and Dr. Solpure decided to start the training program for Ayas or Dais, Vanvasi Kalyan Ashram got associated in the implementation. The organization had the field workers, and therefore knew the problems at the Pada, the problem of communication, problem of illiteracy, and knew that health problems need to be addressed. Once the target was fixed that we will train the Dais, the target population of trainees was fixed as those women who are already working and socially accepted. The plus point of all this thinking was the women stay in the Pada. They are not likely to shift from that Pada, so remain available. They are socially accepted, already conducting the deliveries, and they are respected in the society. So in future, various other programs can be implemented through these activated people. Getting those Dais to Dhule itself was not that easy. Being shy, these people always go away from the city dweller. But then our contacts with field worker and his tours beforehand managed getting 5 Dais to the city of Dhule. Another thing was distance. Dhule is situated in one corner of the previously known as Dhule district. So many people have to travel about 150 kilometers or so, apart from what they need to walk. So overcoming all these obstacles, finally the group came to Dhule city. Then the problems were to get the residence for them and to manage the teaching schedule. Though syllabus was planned, teachers were not always available. So that hurdle we had to overcome. As far as the residence is concerned, the facility was provided by Vanvasi Kalyan Ashram, who runs the hostel for ladies.
It is a hostel for tribal girls. So, tribal women find it easy to mingle with these girls who understand their language and can get adjusted to urban amenities much faster. They cook their own food and carry it to the training site.
We manage group of about 13 doctors who could take at least one theory lecture and preferably two in one day, about 20 minutes one lecture, and to stress certain pre-decided topics, which was basically directed at